When is a good time to start having children? Is there ever a perfect time for this? This is a question not even Google can give you the answer. Every woman is unique with her circumstances, experience, and life expectations. That is why it is important to listen to that woman very carefully and empower her with the knowledge and options to make the right decision for her. Non-judgment and empathy are crucial in these situations, as often she can be fragile coming to see a specialist after a relationship breakdown. It is well known nowadays that time is not kind in reproductive sense to a woman from her mid-30s, worsening as she passes 40 and devastating in its effect by 45. For not only do the number of eggs remaining in her ovaries decreases, but they undergo chromosome changes which often lead to infertility and miscarriages. So if the decision is made to freeze eggs, it's better in general to do this between the age 30 to 35 than at a later age. There are two tests which can further inform the decision to freeze eggs. One through a blood test and the other through a vaginal ultrasound examination. The blood test measures hormone we refer as AMH. This test tells us indirectly if the woman has a high, a low, or an average egg reserve. Through the ultrasound test, we can tell approximately how many eggs can recover from her and what dose of hormones should be safely and effectively used to stimulate her ovaries. Over the last 5 years, the science applied to egg freezing has revolutionized the outcome, and it is no longer considered experimental. We now use a process called vitrification, which avoids destructive ice crystal formation within the eggs as it goes from body temperature to minus 196 degrees Celsius rapidly. Stored and vitrified eggs remain their reproductive potential with no expiry date, and our results show that they are just about as good as when they are used fresh. The process for egg freezing is the same as for an IVF cycle. The only difference being the eggs are not exposed to sperm then and there, but they are frozen until the day comes when she meets the right person she wishes to start a family with. Then these eggs are thawed and fertilized by injecting sperm and achieving fertilization and developing the embryos for pregnancy attempts. If she froze the eggs when she was 35 and used them at the age 43, her pregnancy chances are that of a 35-year-old. The more eggs which can be stored for later use, the better, and the ideal number should be close to 20, which leads to the need to undergo more than one cycle of egg harvesting at times. Even though not all women return to use their frozen eggs, all women would agree about the less anxiety and pressure to settle down when they are not ready to do so. My experience reminds me of women who have used the stored eggs for first baby and others who have conceived naturally with the first child but needed to use the frozen eggs to grow their families. Egg freezing can help avoid the distress of having left it too late, but it is not the same as reproductive insurance, as sadly not everyone gets pregnant through this. So it is advisable, even though you have frozen eggs, to regularly ask yourself, should I be trying to get pregnant naturally now?